Hello everyone, I'm Rowlands. In this session, I'd like to share with you our experience of implementing OpenAthens in the Tasmanian Health Service and the benefits we've derived from the system, both the unexpected and expected benefits. In particular, I'll talk about the single sign-on data we can extract from the system and what it can tell us about our users' experience and our users' use of our resources. Next slide, please. The Tasmanian Health Service is comparable to the UK's NHS, but naturally on a much smaller scale. The THS provides acute care, community and public health, mental health and ambulance services. Tasmania has a land area about the size of Scotland, but with a population of only 500,000. And unlike other Australian states, we don't have one major city that contains most of the population. In fact, the Tasmanian population is dispersed throughout the state, and some communities are quite remote from major towns and cities. So you can imagine that providing a health service in this environment has its challenges. And similarly, providing a health library and information service in such an environment also has its challenges. Next slide, please. While the THS library service has a physical presence in the 4 main hospitals, we also provide services to regional hospitals, district health centres, and to individual care providers located everywhere in Tasmania. As a consequence, most of our budget goes to electronic resources. So these resources are sourced from the major international publishers such as Elsevier, Wiley, Oxford, Cambridge, Walters, Kluwer, etc. And we also have resources from more obscure publishers and Australian publishers. The types of material includes electronic journals, ebooks, both individual items and collections, clinical tools, and databases. Next slide, please. We provide these resources through a portal known as EPOC, which is an acronym for Electronic Portal for Online Clinical Help. As well as regular THS staff, our users include students on placement in THS facilities, such as medical students, nursing students, and pharmacists in training. And most of these are enrolled at the University of Tasmania. And we also have allied health students on placement from other universities throughout Australasia. So how do we give access to all these people to the resources they need? As you can imagine, this has not been a straightforward undertaking. Before 2022, we had contracted an Australian company to provide a bespoke proprietary solution. And this was essentially a URL rewriting program similar to EasyProxy. And while it worked reasonably well, it was administratively burdensome. It was difficult to extract data from and very difficult to make changes to. The contract expired at the end of 2021, and we needed to go out to tender for a replacement. The EBSCO organisation tendered and included OpenAthens as their solution to our authentication requirements. And this was one of the factors in them being the successful tenderer. Next slide, please. The implementation was quick and reasonably painless. And as it happens, we had a very fine timeline. But OpenAthens was up and running on the 1st of January 2022. We've seen a number of benefits going to OpenAthens. For example, it provides increased security. OpenAthens has a secure single sign-on that enables users to access resources with one set of credentials. This minimises the risk of unauthorised access and enhances security for the organisation's resources. It provides easy access. OpenAthens makes it easy for users to access resources by providing a single portal for all their resources. Users can access resources from anywhere, at any time, and on any device. It's also cost-effective. OpenAthens offers access management that eliminates the need for multiple usernames and passwords, reduces administrative costs, and optimises resource utilisation. It also has the potential to reduce licensing costs of resources, as resources can be restricted to a particular category of users. It's customizable. OpenAthens offers a customizable platform that allows organizations to tailor the system to their specific needs. This ensures that the organization's resources are accessible only to authorized users. In our previous system, every user had to be individually added to the system. But now anyone who is a THS staff member can sign in, as staff members are automatically authenticated using Active Directory. OpenAthens is very easy to use. It enhances the user experience, encourages users to access resources. However, the biggest advantage over the old system is the user and usage data we can get from OpenAthens. The available data is comprehensive and granular, and when combined with data from publishers and network traffic information, we can form an incredibly detailed picture of our users' activity. Next slide, please. OpenAthens reporting allows us to generate reports across a variety of measurable items. As standard, 3 different types of reports are available: authentication, resource access, and aggregation. Authentication reports provide information about signing into OpenAthens. So it tells you how many users' sessions there's been and by how many unique users. The resource access reports show attempts to access particular resources. But the most useful ones are the aggregated data reports. So this is about data connected to particular fields that are just automatically added up. So I suppose the most basic example of this is the date. The system automatically adds up, how many of X or Y happens on a certain date. So we know yesterday or last Thursday, what happens. We just have to access the reports, and it's just there and just display. The reports automatically aggregate on other things too, like days, months, permission sets, and user groups. But the really useful bit is that you can aggregate reports on anything in the schema. So to make the most of our reports, we've needed to make sure that the accounts for our users are issued to include all the relevant information that we might want to report on. So in our case with Active Directory, we map to those attributes in another system, and then OpenAthens can just aggregate on that. From what I've said, you might not think that this reporting is particularly different or unusual, but I think where it really stands out is the fact that it's just there. We don't need to request our IT department to do extractions. We don't need to schedule overnight tasks, and we don't need to wait for monthly reports from vendors. And any library staff member can just log in and easily see it in a readily understandable form. I think using OpenAthens has meant that all of our resources have increased across the board. We have to assume this is primarily because it's the easy access afforded by OpenAthens. But it's maybe partly the better design of our new portal, but the design of that portal has been driven partly by that OpenAthens data, because we can see what users are wanting and what they're using. I'd have to say that we haven't taken full advantage of the data yet, but so far it's assisted us in making a number of decisions on things like return on investment, what subscriptions we should continue, what needs to be promoted more to encourage use, and what is changing in use over time, and what's high use and needs to be front and center in our portal. Next slide, please. So there's actually been some quite surprising insights from the data, insights that we didn't really anticipate. So here on this slide, we can see the front of our Epoch portal, and on click links there are all the items that seem to be used the most, and we've determined that from that OpenAthens data. We can see what people are using the most. Next slide, please. This report from OpenAthens shows the stats for last month for the usage of the Australian Medicines Handbook. And you can see down the bottom, there's some classifications or categories of user. Under other there, that's people who are just using a generic login. Department of Health staff, that's people in the department who are logged in off-site. There's Ambulance Tasmania staff, that's sort of obvious what that is. There's visiting affiliated practitioners in green there. But the one with the really high numbers is visiting affiliated students. So we probably wouldn't have really thought that that was going to be the group that was using this resource the most. But after thinking about it, it probably makes sense. It means that that helps us make the decision about that particular resource and perhaps target it more to students. I guess it shows other insights too, like this reinforces the importance of our role, as teaching institutions or providing teaching institutions such as our hospitals. Of course, these are just some examples of the way that user data from OpenAthens can give insights into users' preferences and their resource usage. But I think they're quite indicative, and as I said, we don't take full advantage yet. There's plenty more of other ways that you can use the data. Needless to say, I think from what I've been saying, you can see that we've been very happy with our change to OpenAthens. And if anyone's interested in hearing more about our implementation and would like to contact me and have some discussion, perhaps you're thinking of implementing the system as well, I'll be more than happy to talk to you, and I can be contacted if you just Google the Department of Health in Tasmania and library services. You'll find my email there, Derek Rowlands. Thank you.